everyone can hear me and see me okay. I'm Dr. Relan. I am a pediatric allergist and immunologist in private practice. I am in central New York. So if anybody else is from New York, hi guys. I really love education and teaching, and I miss it. So this is a really cool opportunity. So thank you for having me here today. I don't want to take up a huge amount of everyone's evening, but I wanted to kind of give you a glimpse into my world. It's busy, it's high paced, believe it or not. And I get asked a lot about doesn't it get boring seeing asthma every day and all day? And actually that's not all I do. So no, it doesn't get boring. And one of the best things about my field, hands down, is that I get to see all ages. So back when I was in med school, I had a hard time deciding what I wanted to do because I liked a little bit of everything. And mostly I fell in love with pediatrics because you can't get mad at the kids for getting sick. But I missed seeing adult patients, and allergy immunology is a field where you get cross-trained. And then during the pandemic, who hasn't fallen in love with the immune system as you see it unravel in front of your eyes? It's such a beautiful system that impacts every single other specialty. So it's a great way to see the body as one big whole picture. And I think that's super fascinating and cool. So I didn't know if I should ramble or if you guys had questions and we should do a question answer session, or yeah, if you had anything in particular before I kind of delve into how my day and what I see day to day.
Yeah, so if anybody has any questions, you can put it in the chat, and hopefully, Doctor, you can see them as they pop up.
Okay, yeah, that'd be great. I don't see anything at the moment, but if you see them, Mahi, if you wouldn't mind perhaps reading them, and I feel free to interrupt me at any time. So I think what I'll do really quick is just give you an overview of how to become a pediatric allergist and immunologist, and then I could talk a little bit about how my specialty and the different ways you can practice the specialty, and then I'll kind of go into what I do in my average day like today. So to become an allergist, immunologist, the first thing you do is you go through obviously medical school, and then you pick a residency. You can either do pediatrics or internal medicine, and that's it. Those are the two specialties, general kind of fields to start with. And then after 3 years of pediatrics, or 3 years of internal medicine, or 4-year combined med peds program. So you do your residency and then you apply for fellowship. And then allergy immunology fellowship can be 2 years long or it can be 3 years long. The programs across the country vary depending on research interest and whether you're more interested in an outpatient setting. So allergists can practice in so many different ways, which is what's so cool about medicine. And especially in this day and age in 2021, there's no reason that you have to be fully clinical. So you can do research, you can see patients in the office, you can work for a hospital-based institution and still do practice. And most allergists work 8 to 5 kind of jobs. So Monday through Friday. Some allergists, some of my friends work Saturday hours and have a random Wednesday off every week. And there is call. So you still deal with some acute emergencies, but they're very far and few between. But that's kind of the big overview of the field. And I have friends who are doing telehealth and teleallergy. I have friends that are doing research trials and are involved in the vaccine stuff with the COVID vaccine. So there's a big range. So in the field of immunology, you can subspecialize into vaccine studies if you want to. You can subspecialize into angioedema. You can subspecialize into food allergies. So there's people that have kind of taken a niche, if you will, into the field of AI. Any questions so far about either how to get there or what your kind of setup can be like after? I'm not seeing any questions pop up. Any tips for medical school? Any tips for medical school? So do you mean in terms of if you are a med student and you're interested in allergy, how to proceed? Um, so thank you for the question. I had no idea that I was going to be interested and become an allergist immunologist. And so the tips that I have for med school is just focus on med school, like learn what you're currently uh, rotation wise what you're doing, because everything and anything is applicable when it comes to especially AI, because I told you it impacts the body from head to toe. So a little bit of cardiology, I dabble a little bit in the pulmonology, I dabble a little bit in GI. Actually, I dabble a lot in GI. So it's just like really nice to have a well-rounded approach. I learned so many things in med school that I still apply today, because you need to know a little bit about all the other body systems and how they can impact your immune system. I think I did see another question pop up. It was something about residency. So what residency did I end up choosing? I chose pediatrics, and I really liked the fact that there were kids. Like kids make me so happy. There's just such genuine innocence and the resilience that is present in a child, and their needs and wants are just so simple, and the littlest things make them so happy. And when you see them sick and you can see them smile and play through their sicknesses, it's just amazing. I just wanted to kind of run to them. I'll tell you something that a mentor of mine told me that helped me a lot in med school, because I struggled with finding a specialty. And the thing that an ER physician told me was that, all right, pretend you're walking into the ER right now, and there are all these sick people in the waiting room. Who do you want to go treat first? Do you want to go treat the pregnant lady first? Do you want to go treat the 2-year-old boy that's sitting there maybe coughing, or a broken fracture? Like, what patient draws your attention, your mind, and makes you really happy? Because at the end of the day, we need to enjoy our jobs. There's so much about medicine that's paperwork and nuances, but like seeing patients is what makes me happy. And so kind of find your happy place, if you will. I was able to get to the question box, you guys, for like a quick second, and I'm not sure where I went from there. But I think I saw something about why I ended up picking allergy immunology. And the story is that I find the immune system really interesting, and I always have. And I feel like I like the way it connected everything. I like pathways. And I fell sick in residency, so I thought it was really cool to figure out what happened with me and my immune system. And I think there's like the fact that it was outpatient, so I had wanted to I was sick of being in the hospital all the time. It came natural to me. I majored in food allergies. I guess I majored in food science, and the food allergy part of it came really natural to me. I really like talking about foods. I feel like it connects all of us as human beings, since that's like one of our major necessities. And I think food is medicine. And I like that the food kind of like combines and kind of rolls with everything together, with the immune system and the pathways, and just how we, as the big picture, how we feel, and how we think, and kind of like our motivations. So if that makes sense. I'm trying to find the other questions, so I apologize. I'm flipping through some screens here and just taking note of everyone here. I lost the question screen, Mahi. I'm looking for it.
That's okay. I'll just read them out to you.
Okay, thank you.
So there's a question. How did you pick your specialty? Did you consider any others?
Oh, yes, I did consider many others, you guys. In med school, I was between OBGYN and pediatrics, because I think women's health is fabulous and important. And being a woman myself, I wanted to understand it intimately and like really know the ins and outs of the human body when it came to being a female body. And I seriously, as a third year, every rotation I started, I was like, I love this rotation. This is so cool. This is so fascinating because the immune system, the body, the everything about being human is so fascinating. And so I liked every specialty except for like neurology, actually, and contemplated doing each one. And then I started ruling it out because I started saying, okay, if I'm in the ER, what am I most attracted to? What am I finding really annoying about the specialty that I don't like? Or maybe with the surgery, I feel like you're either surgically minded or you're not. And I loved surgery. I actually got to first assist and do some really cool cases, but I just didn't like the hours and I didn't like the commitment. And at that time, I didn't have any good female role models. I feel like nowadays you can see so many women in surgery that are kind of caving their own path, but I didn't feel like I could be a good mother and be a surgeon at the same time, which is ultimately what I wanted in life, was to be a doctor mom. But that was me personally. And so I think you have to kind of look and say, if surgery interests you, do it. Like, do what makes you happy and what will bring you joy, because life is short and you should really just stay true to you. Um, and well, in residency, I was between NICU and PICU, so intensive care unit. I really liked the sickness. I liked the acuity. I liked being busy. I liked doing procedures. And so I literally had my application for the PICU when I got sick. And so once I got sick, I realized, okay, I don't want my life to be that I'm either going to be a doctor or I'm going to be a patient in the hospital. Like, I want to leave the hospital setting. So getting sick was my turning point in my own personal life. And as I mentioned, that's what made me so much more fascinated with the immune system. But I took a year off in between residency and fellowship. And I think people don't talk a lot about that, but it's so important to take a break if you're not sure what you want to do. I finished my pediatric residency so I could become a hospitalist. And so that way I kind of had no commitments except for 1 year. And I decided to become a hospitalist in the NICU. So even though I didn't end up doing my NICU or PICU fellowship, I was like, let me just make sure that this is like the right decision for me, that I'm not just acting emotional and that I'm actually putting some good thoughts into it. So that was kind of like my perspective. The hospitalist year in the NICU, all I could think about was allergies and like reading more about immune system. And so I was like, okay, no, I made the right decision to pursue fellowship. Mahi, will you read the next question?
Yeah. So, why did you choose to become a pediatric allergist once you were in medical school? What captivated you?
Yeah, I didn't know in med school. So I didn't become an allergist until, like I just mentioned, until residency. So I think just keeping an open mind, and just doing the best you can, working hard in the field that the rotations you're currently in, because you don't know how that's going to carry over. So like when I was doing surgery, for example, like I, first assisted a lot, and it's like, now I know what it's like to have your gallbladder removed, and I know what it's like to have your appendix removed, and I know what anesthesia is. And so therefore, when I am an allergist looking at the anesthesia drugs, it's like, oh yeah, I remember the induction phases, and these are the drugs that are typically used to treat, and to put people under, and then the pain control meds. And so like now I have the picture of how things go in the other fields, so that when patients are referred to me, I know what to do and how to help them.
So the next one's a couple questions in one, so I'll just read them as they come. So I know you said the resilience children have really captivated you. However, are there other aspects children have that is inspiring and encouraging?
Yeah, I mean, they're just happy. Kids are just, their innate desire is just wanting to spend time with you. I I have so many fond memories. Like, yeah, when kids cry, it hurts your heart. But I think knowing that like you just need to do this, you just need to like do a spinal tap, and you just have to hold the child down, and you just have to do it. And then they bounce back so fast. I think just the fact that they're so forgiving and all they want is your love and your attention. It's like so simple. They're their smiles are just so beautiful, no matter how sick they are.
It's really lovely.
Yeah.
So many people say that it might be stressful working in pediatrics because the patient is not only the children but the children's family and guardians. So you
Mhm.
must work to guide and help anxious loved ones while watching their child being sick. Do you agree with this or have a differing opinion?
No, I agree with this. I I think especially now, you guys, I don't know if I mentioned this or if you follow me on Instagram, but like I'm a mom too, and so being a mother, you just like you definitely like have to rely on some adult conversations about like, am I overthinking this? Am I worried too much? And so yeah, it is two people, but I think it's the fact that you can relate to the parents, and you can, even without having had children, you can relate to the parents, and you can say like this, I'm your child's advocate. I'm looking out for them. Like I have the science, I have the evidence medicine background to say like, these are the recommendations and this is why I'm making these recommendations. So it is like treating two people sometimes, especially with the teenagers. But I feel like it's easier to deal with that than to deal with adult children, because I saw that a lot in medicine where, my patients were 70, 60, 80, and like they had their 30-year-old, 40-year-old kids. And I'd rather deal with young kids and their parents than older, older parents and their grown kids, if that makes sense.
So what was your experience like working in the NICU?
I loved it, and I still miss a little bit. I would say procedures, like allergy is not as heavy on hands-on procedures. So our procedures in allergy are skin tests, which are scratch tests or intradermal testing, and then patch testing, and then spirometry, which is obviously pulmonary function testing. So there's like, thank goodness, in some regards, knock on wood, I'm outpatient. I don't really want to be treating and putting in IVs and pick lines and intubation, but I feel very confident. I got good training. I know I can do it, and I can deliver a baby if I need to, but I don't want to. Not outpatient, at least not here in my office. But the NICU world is fabulous. It's high paced. There's like beeping machines and lines. It's really, really, really sick kids, sick babies, premature babies, but outcomes are so wonderful. Physiology is heavy in the NICU. The world just kind of, you view the world almost with a microscope, because everything is so tiny. And I think the most surprising thing about the NICU is like how well kids do. Even, there's some sad births and there's some sad outcomes, but overall kids do really well. And we can save kids that are 24 weekers. Like, that's amazing.
Um, Besides academics, what are some things you can do to better your chances of getting into medical school?
So I did a lot of volunteering, and I made sure that I wanted to go into med school. So um I did different levels of volunteering. So I actually volunteered in a hospital setting. I volunteered in a outpatient medicine setting, so like a neurology office. For the hospital, I was at the children's hospital and we worked in the playroom. And then I also worked with the regular medicine floors where I delivered like papers and books and reading material. And then I was around if the nurses needed any help with like little odd things to do, like, can you go get me these clothes for this person? Or I used to just run little errands for them at the nurses station. And it was just like seeing the different parts of medicine to make sure that I liked being in those areas. You know what I mean, you guys? Like, the word resident means like you are living there. So like in residency, you're like living in the hospital. And so I wanted to make sure I liked where I was and I liked the people that I was around. So shadowing and volunteering was like a big component of my pre-med life. And then the other thing I did was I joined pre-medical societies and associations, and I took some leadership roles. because I think med schools want to see that you're going to be innovative and you're going to be at the front of things. So, yeah, I joined our pre-medical society and I became the secretary and then I became the president. So that was kind of cool.
So just backtracking a little bit. So with working with sick children, how did you balance your emotions personally while dealing with the parents?
Yeah, I use this method called box, like a box method where you're like, I'm like, this is not my child, which I think helps a lot. That's why you shouldn't treat your own family. And I walked in there just thinking like, this kid is sick and I just got to stabilize him. Like, I just got to make sure, is he breathing well? Okay, good. And then is his heart beating? Okay, good. All right, now let's look at the big picture. Like, is it, is he there for a fracture? Is he there for abnormal blood work? Is he there because of a rash? Like, whatever the picture is, but kind of just approach it and just realize like you just have to do this. So you can't be emotional. It just has to be matter of fact. Just have to do this. You just have to hold your child down. We just need to get the blood drawn, or we just need to get IV access. Like this is just needs to be done. And kindly, I mean, I don't like, we would give pain meds and stuff, like we don't just randomly do things. Like, so we work our way through it. We talk about it if the child is age appropriate, or you use child life services. So you have other people there to kind of help you through some of the procedures. But I think it has to be like a joint thing and getting the parents to understand why you need to do something.
So out of curiosity, how many medical schools did you apply to? What was your undergraduate major? And if you did anything special during your time as an undergrad?
I applied to a lot of medical schools. I don't even remember, probably in the 20s, because I was paranoid that I wouldn't get in. My undergrad major was nutrition and food sciences, and I did a global health as a minor, and I had honors with that. So I focused a lot on nutrition because I knew that I liked food sciences. And I figured, well, food is medicine to me. And it wasn't my culture. And I had a lot of, growing up in two different cultures, it was kind of a nice approach to understand like why my parents do certain things and then like why do my friends do different things. And then I learned that in med school, we don't do a lot of nutrition. So I had a lot of background in nutrition sciences, which I thought was really cool and helpful. And then I forgot the third part of the question, Mahi.
If you did anything special during your time as an undergrad?
Oh, yeah. Just like I did a lot of volunteering. I did a lot of like clubs. And I think like the best advice I got about undergrad was like to major in something that makes you happy and you can fall back on. So like everyone's going to major in biology, but does that make you happy? Do you like bio? Because I took my first bio class and I was like, I do not like bio. Even though I like medical bio and I like the body, like undergrad bio is not the same thing. And I took anatomy and physiology in undergrad, which I think helped me a lot in med school because it was like a jumping point, it was like the first like 2 weeks of med school was like a review of everything I learned in my entire undergrad of anatomy. And so that was kind of nice to have that refresher before I jumped into more stuff and more levels of thinking. And then I'm trying to remember what else I did that was big. I think it was just being around in finding the interesting things. I also traveled, and I can't tell you how important traveling is to just opening your mind. And obviously, it's really hard to do that right now with the pandemic, but just it's good for growth to get out there and see different people, see what life is like in their shoes, and recognizing racism and recognizing the kind of like the systems that have been built into the lives of these people in and around us. So like I worked in a domestic violence shelter in undergrad during a spring break. Like, I mean, I went to like I've been overseas and just seen like life elsewhere and like medicine practice elsewhere. So I think that was really good.
So What type of leadership roles did you take on?
I mentioned the pre-medical society. I was I joined the pre-medical society as like a member. Then I became the secretary, and then I became the president of it. So I remember during my med school interview, they were like really impressed that I became the president of something because I was really shy. Believe it or not, I'm very much an introvert, and so it was really like hard to be social and talk to strangers and get out there and make myself like somewhat known. So that was like a big coming of age kind of thing. Um, and then kind of went into it slowly. I found some like older um, like undergrads, so like, you know, second years and third years to help guide me in the pre-med society, which was really cool. I found people to help read my papers and kind of like proofread like stuff that I was like, you know, applying the application stuff. So that was neat.
So, what do you think are the greatest challenges in completing medical school and becoming a physician?
So entering med school, I think the greatest challenge was just, all right, thank you. Was just it's competitive. And I think like that was just hard to deal with, that you're like you're so interested, you're so passionate, you put in all this effort, and then being like, am I going to get in, is somewhat stressful. So I think just working hard and then realizing like it's okay to have a plan B, and it's okay to apply more than once. I didn't even tell you guys that part. So I graduated early from undergrad, and then I didn't get in to med school. And they told me that I was too young, that I should have finished and I should have taken 4 years. And they were like, you know, we just aren't sure that you are sure that you know what medicine is really going to be your field. So I kind of took the extra time to do more classes, like because I finished early, and then I actually traveled for the other half of the year. And I think that was really cool because I think, like I mentioned, traveling is like, you know, a way to grow. And I traveled alone, so I forced myself to get out there, even though I was super nervous. And I, like I said, I was an introvert. I didn't like being alone and outside of the United States on my own. But I went to an English-speaking country so that I wouldn't have to worry about the language as a barrier. But I think that was like an interesting thing to do, and that gave like talking points during my med school interviews. Like they were like, oh, why did you do this, and what did you learn? And it was just another way to say like, look, I took time off and I still want to do medicine. Like I'm not going anywhere, and you're going to accept me. So I think just knowing what you want and then just keep going. Don't give up, you'll get there. Work hard.
So, what kind of opportunities did you do as a high school student?
Was forced to volunteer as a part of our graduation requirements. So I volunteered in a nursing home every Saturday or Sunday, and I used to do 2 to 4 hours. And that was kind of just like a little bit of a segue, or a little bit of like interest and intro. And then I worked in a outpatient neurology office over the summer to make sure, as like I think I was like a medical assistant. I just did like blood pressure and like a heart rate. And then after that, they used to just put me in the file room. And so I don't know, you guys, paper charts were like intense, and I had to like alphabetize them and like put the old ones away, and then take out the new patient charts for like the next, you know, next week or whatever. And so just like being in the office building and seeing if I wanted to do this.
So did you always want to be a doctor?
I wanted to be in the medical field since about 10th grade. 10th grade, I took a health and careers elective, and I was like, this is so fascinating. Like, the body is so cool and I want to understand it. When I was in undergrad, I actually started undergrad as a computer science major because I wanted to have something to fall back onto. But my first class of computer science, I was like, I can't do this. Like, I cannot like be coding and working with binary digits all day long. And so I think like finding, like I said, like finding what motivates you and you like, and something that you can fall back onto. Because I could see myself being a teacher, and I could see myself, being a social worker, and I could see myself being in anything in the medical field, but not certain things. Like I did not want to be a dentist. I didn't want to look at people's teeth. And there were things like I just was very like, this is not for me. Like a physical therapist was just like not my favorite thing. So just kind of recognizing what works for you and what excites you.
So could you describe your current work schedule and how has your practice changed during COVID?
Yeah, totally. So I work Monday through Friday. I'm a full-time pediatric allergist. I cut back time after having my second child, but it's basically using my vacation time and just kind of structuring it so that I can end my day a couple times a week on a reasonable time so I can be home with my kids. I see somewhere between 12 to 20 patients a day. It depends on the day. And we see a bunch of new people, so people we've never met before, and then a bunch of people that I've established relationships with for follow-up. It is completely outpatient medicine. The new patients that like I saw, for example, today were people with eczema, with hives and swelling. I had a patient who had a question about food allergies, and then I had another patient who had been exposed to something, and for some reason her face got swollen and congested, and so she was here to find her triggers. So new patients are like just so much fun. It's like you're a disease detective. Like you get to figure out why are they having these problems, and so you have to be a good listener, you have to ask the right questions, you have to have a broad differential, and then you have to think, does my testing apply to them? Like what can I do to help them figure out what happened or what is happening? um, and so the new patients go in for testing, and then I start seeing my established patients while the new ones are in testing. So at like one given time, I can be seeing like 5 or 6 people at the same time. So it can be really busy, but kind of fun. And that's where I was talking about, like we hit the ground running in allergy. So I do things like food challenges to make sure kids are growing out of their food allergies. I do things like penicillin allergy evaluation. So people that think they're allergic to penicillin, are they really? We do skin tests. We do challenges where we give them a little bit of penicillin and watch them and make sure they're okay. I also test people for vaccine allergy. So if you have an allergy to anything, I guess you name it and I can probably test you to it. And asthma is not all asthma, not everything that coughs or wheezes is asthma, not all asthmatics wheeze. So kind of like anyone that comes to my office, I kind of ask myself, okay, who diagnosed you? And does your diagnosis make sense? And then I kind of like phenotype them in. So like I kind of just like divide them into like what's actually triggering it and how can I best treat them. So there's a lot that goes on in our visits. And at the same time, while I'm seeing all these patients, there's allergy shots happening. So people who have allergies to the environment or to bee stings are getting something called immunotherapy. And immunotherapy is allergy shots, like a desensitization, so you can outgrow your allergies. And they're just sitting out there in my waiting room getting their shots while I'm seeing patients back here. And so today, for example, I had an allergic reaction. Occasionally we'll get an anaphylaxis. And so I treat that in the middle of seeing all my patients. So it can be really, really busy.
So what was the most effective study method that you have used in the past?
That's a super awesome question because I thought I knew how to study. I was I thought it was pretty okay. Like I could, cram things in and pass my tests. And then I came to med school and I realized the way I studied was all wrong. And I had to relearn how I studied. So my big advice to you guys is like, figure out if you are a good audio or a more of a visual learner. And then realize whether you need to be rewriting or drawing things. So like I am 50-50. I need to hear things and I need to see things. And so I actually work best if I rewrite all my notes, like by hand. And like something about holding a pen and taking notes makes it like ingrained into my head. And then what I did, because I could do that, is I was able to condense things and I needed to see things in a like on one page of paper. So like a week's worth of medical school lectures, like I could like cram one day into one page so that I could see all of it all at once and get the big picture and then look at the details again. So I learned that highlighters and colors are nice, but I'm much more of an audiovisual.
Um, what are the most important qualities of being a good doctor?
I think being a good listener, caring, that's what I hear from all my patients. That thank you for listening. Thank you for answering my questions. And thank you for just caring and being an empathetic person.
Um,
Guys, the most obvious too, Mahi, of course, is like obviously you have to be well read, you need to keep reading. So lifelong learning over here.
so how often are you seeing general patients outside of your specialty?
No, I'm not. I'm a full-time specialist. So I only see allergy immunology patients.
So what were your marks like during med school and as a high school student?
I don't remember. So that's how important it is. I think I don't remember. I know I was pretty, top notch. I mean, like I took a lot of AP classes in high school. So I started undergrad as a second year because I had so many credits. And so our school did an honor system. I grew up in Michigan. And so my GPA was over 4.0 because of the weird system that they use. And I had a full ride because of my academics. But honestly, guys, I'm not a number person. And I don't think numbers matter that much because it's more about you being dedicated and excited to learn and working hard. Like I think that's what got me through everything, and to this day that's what excites me, is like working hard and wanting to learn and wanting to teach and wanting to talk to people about things you're passionate about. Like it just comes and flows out of you. So I'm so sorry, I'm like not the best person. I think I can tell you for sure that my scores were not that great because I'm a horrible test taker. Like I see the grades, I'm like, yeah, it could be B or C. And I could talk myself into D too. But it's like realizing like you don't have to be a great test taker, but you just need to know your knowledge base. You need to have your foundation. I've never failed any of my board exams, but medical school was really, really hard. And I definitely failed my first exam. So I think like that was a wake up call, and to be like, okay, you can work your butt off and you can get here, and then you have to like prove it and you have to stay here. So I think just knowing intuitively, like for some people they have this amazing photographic memory and they can just learn things and they can just move on, read it once and know it all. And that was never me. So numbers matter, but so does dedication.
So do patients get recommended to you, or are you the one who diagnoses the allergy?
Yeah, kids and adults get referred to my practice. I work in a group practice, so I'm not alone. So I work with a bunch of other doctors who are all allergists, but they get referred by their primary care. So, and they don't always have to. I guess that's kind of partly true. I also have like dermatologists and I also have ENTs that refer patients to us and say, oh, can you test this patient? Like we see an eczema rash, can you find out if there's any food allergies? And I had that today. Or ENTs that are like, okay, this patient's coming to us and they want sinus surgery, but we think they have allergies. Can you test them first? So that happens. And then sometimes people just find me because their neighbors heard about me, or their cousin comes and sees me, or they know the name of our practice because we've been around in our area for a long time.
Are you currently part of any research, or have you been part of research in the past?
You have to do research in your fellowship, and I definitely did research in my undergrad. No, sorry, in my residency. So once I decided to become an allergist, I found a mentor and did an outpatient rotation. And then I made up my own research project, and I asked the attending if I could work with her on this research. And so I did that in undergrad. No, sorry, I keep saying that. I did that in residency, and then in fellowship, absolutely, I did research because it's part of my training.
Do you have any interesting or fun stories that you'd like to share?
About patients or about myself?
Um,
Anything in particular?
we can give them a second to follow up.
Sure, yeah, I'm here. I'm trying to think of I have so many stories, but like, what's interesting? Oh my gosh, okay, I'll tell you one off the top of my head. But I don't like, I get worried because I'm like not sure what's HIPAA, so I'm like, I don't know if I should be talking about patients quite yet. But just in general, I've had people do some funny things. Yeah, I don't know if I can talk about it. I'm so sorry, you guys, because I don't want to break HIPAA, and I don't want someone to view this recording later and be like, that was my mom, or that was me when I was 4. So if you don't mind, I'll hold on to some of those thoughts, and just know that people are funny, but we are all individuals, and we are all quirky in our own ways.
So a question about yourself. What's
Yeah.
your favorite place that you've traveled to?
Morocco. I went to Morocco, and I went to the Sahara Desert. I took a camelback ride into the desert, spent the night in a sandstorm, and had a campfire meal and did like kumbaya singing, looked at the stars. I went with my sister, who's my best friend in this entire world. And it was like so amazing to be in a desert sandstorm, and all you see is sand, and then the night sky, and just it was just like a forever memory. But I've traveled a lot of different places. I've been very blessed. And so the other big one, like Machu Picchu, and like the United Kingdom, like they're all just so many gorgeous places in the world to see. Oh, China, Great Wall, I did that.
So if you could change anything about your profession, what would it be?
Oh gosh, that's easy, you guys. This paperwork, I like saw so many patients today, and I have so many charts open. If there's one thing I would change, it's the insurance companies and the pharmaceutical, like the whole jumping through hoops and getting this covered, and then all of a sudden that like drug is no longer covered, and I have to switch the patient to another one, and then they don't know how to use that one because it's a new inhaler, or it has a different technique, or it has to be used twice a day, and their old one used to be once a day. It's like a pain in the behind. I would change all the insurance mumbo jumbo.
So what are the best and worst parts of your job?
Okay, that one's really easy too, because I feel like it's like so obvious. The worst part of my job is probably the fact that like my hours are really long, and my hours are really long because I need to have time for my patients to get allergy immunotherapy injections, which is the allergy shots I was talking about earlier. And then I would say probably just dealing with like a whole bunch of stuff all in the short amount of time that we're at work. But that's also the best part of my job, is that it's Monday through Friday. So when I go home after you and I are done, I'm done. Like my night will be over, and I will be home with my kids and my boys. So it's a mixed bag, the outpatient medicine world.
So how do we get started with research?
Yeah, that's a really good question. I think finding a mentor is really important. So backtrack and say, what are you interested in? So if you're thinking, okay, I'm thinking about kids, or I'm thinking about medicine, or I'm thinking about, a subspecialty like dermatology, whatever you're interested in, find a mentor, find someone that you either know through your family or through a teacher, through a pre-medical group. Excuse me, express interest and ask if you can shadow that doctor. Ask if they know of research going on. A lot of places that do research are like academic places, so like universities. And so like through the hospital, you might be able to find somebody and ask, and then get involved. Ask to do the stupid mundane things that the fellows and the residents don't want to do, like data entry. Like be like, yeah, I can put all your Excel files, like, oh yeah, I can go pull all the charts out, or, I can go print all of this stuff that you want, or photocopy the stuff, or go get the books that you need from the library. So I think the first thing is finding a mentor, finding a project that's going on. All fellows are required to do research. So remember that it goes pre-med, then it goes med, then it goes resident, then it goes fellow, then it goes attending. So fellows are always doing research. So find a fellow and ask them, can I join you? Can I help you?
So do pharmaceutical companies put a lot of pressure on doctors to prescribe certain drugs?
No, they come around if you let them. Like I'm in private practice, and my nurses ask me, oh, do you want to see this person? They're asking to see you. And I'll be like, yeah. Or I'll say, nah, I'm busy today. So no, I don't feel pressured. I listen to everybody. And if I have time, if I was like today, I was busy and I was like, I can't chat for long. I gotta go. I have patients waiting.
So what do you do if you're not sure something or how to treat a patient?
I work in a group practice. So if I'm not sure, I tell them where, like if I've sat through and I've thought about the differential and I can't figure it out, and then I have a group. So I talk to the other partners at work and I say, hey guys, like this is what's happening, or I'll email them, or I'll ask, hey, can someone look at this patient's chart and tell me what you think? What questions would you ask? What are there any other blood draw that you would think of doing? So I have like my partners to fall back on. And also as an allergist, we have a very small community. So we have a huge network where nationwide we're connected to all the other allergists. So online we can ask, we have a forum and we can pose questions there.
So this person's saying that they're also interested in pediatrics as well, but they're not sure about the different branches. So is there something that you recommend to be able to explore the different branches and exploring the field as itself?
Oh, of pediatrics itself? Yeah, the American Academy of Pediatrics, the AAP, has like a list that you can like even Google the fellowships. And so if you're thinking not just general pediatrics, you're thinking, oh, like adolescent medicine or hemonc or infectious diseases or kidney, like nephrology, pulmonology, there's like a section and you can actually see all the different subspecialties, and obviously the ICUs, the pulmonary critical care, or the PICU, pediatric intensive care unit, the NICU. So there's tons and tons of specialties.
So what are some hobbies that you do in your free time?
You guys, I barely have free time. I'm just joking. So my free time right now is like I'm a mom and I'm working full time. So once the boys are in bed and if I have done all my charting for the day, then I do a little bit of reading. I like reading like normal non-medical stuff. I like dancing. I like cooking and baking, of course, because I'm all about the foods and like using what I read, which is like microbiome data, or like how to make ourselves healthier, what nuts and seeds, and how to make like something that I love, like a chocolate chip cookie, but to take a twist and to make it healthy. So I enjoy being in the kitchen and like inventing my own recipes.
Um, so how do you prevent burnout in medicine?
Oh, exercise and meditation. Those are my two big things. I like dancing, so I'll just put on music and dance, or hiking and walking, and then yoga and then meditation, just so I can like relax and bring my space down. Carving my time out. So I told my partners like I need to adjust my schedule because I need to be home with my kids. So I think just knowing and recognizing what your needs are and taking a pause and saying, I need help, or I can't do this, or no, I'm not going to do this. So I think those are really important skills that we gain over time. But if you start sooner, that's more power to you.
Um, what are some new research areas in allergy?
Yeah, I think food allergies is always ongoing research. There's a lot of interest in something called oral immunotherapy, which is a way to help people outgrow their food allergies or treat them or cure them. I think that's like huge. Microbiome is huge. Epigenetics is huge. There was a little bit of time where angioedema studies were like big for hereditary angioedema. It's a type of genetic condition that lets you where people just get swollen, like swelling of their lips or swelling of their hands, swelling inside their stomach for like days. There used to be a lot of research and interest in that, but I think I've seen a little bit less on that. Eosinophil esophagitis is an allergic condition of the esophagus, and I see a lot of studies on that. So a lot of food-based stuff. Eczema is always ongoing, and asthma is always ongoing. The studies on that.
So is group practice different from private practice? Like group practice is owned by a company, unlike private practice.
No, actually, my practice is our own private practice, so I'm a part-time owner. So meaning like I'm only one of a group of doctors that co-owns this practice. So it is like a private practice, and there are different types of group practices. So there are people that are like allergists that are working with ENTs, and so they're ENT and allergy practices. Or there's allergists that work with dermatologists and primary care, so they're like in a multi-specialty practice. There is the academic practices that could also be called group practices because they work with a group of different doctors together.
So is being a doctor exactly what you imagined?
No. I think I had like this beautiful idea of like, oh, I treat people, they get better, and everyone's happy. It's not that easy. Like I said, there's just a lot of red tape to go along with the diagnoses and then the insurance companies. And so it's not exactly like I imagined it. And I was one of the last classes, you guys, that went like the paper charts. Like I was the last class to have the paper charts. And so we switched to the online like EMR systems in my generation, like my growing up and practicing of medicine. So it's like so different. And at the same time, I think the fact that we have social media and people can get connected, and so ideas can change and transfer, and systemic racism or like harassment and sexual harassment stuff that's happening, and these movements that are taking place to make the generations after us happier and safer, I think are like so cool that the practice of medicine is so different, and I think it's a good thing.
So how do we find someone to mentor us or help us to get started with research opportunities?
I think finding your interest first. So find out what you're interested in. And it could be biology, it could be plant medicine, it could be the nutrition lab, so just you have to find who you're, find out first from yourself, like what you want to learn more about. What about medicine like do you like? Because there's so many parts of medicine. Do you want to learn more about being in the OR? Do you want to learn more about being in a clinic? Do you want to learn more about being in a hospital? Like, where do you want to start? Because like what will get you up out of your day and excited to go to that place? So I would start with that first.
Mm, So do you have any advice for high school students who want to go into the medical field?
Yeah, I think Do some volunteering. Like I mentioned, like expose yourself to the medical field and make sure you actually like it and like being there. And if able, like there's positions like scribes. A lot of doctors I know are always looking for scribes, or people are looking for, just like medical assistants. If you guys can find an opportunity to just to get into someone's office, it's so hard right now with the pandemic. So we know life is different, but if you can somehow get exposed, go get exposed, get out there and do it for free. Don't be looking for money, because start out with just wanting to volunteer your time, and then if it becomes like an employment opportunity, that's awesome, you can always get there. But I think if you just start with just wanting to be exposed, your enthusiasm will speak for itself.
So are there any PAs or NPs at your practice?
No, not at this time. We're a physician only group. Not to say that you can't have mid-level providers, but just at this time, that's just how it worked out.
So that's the end of the questions for now. So if anybody has any last questions, I guess we'll wait a minute or two.
Well, yeah, I can't believe it's already 6 o'clock. Guys, it went by fast. Oh my gosh, I didn't realize I could talk this long. I'm so sorry that I kept you here so long.
No, it's real. So any last bits of advice before we end?
I think just finding something that makes you happy, finding joy, because there's so much in this world, that can bog you down. So, and then being flexible and keeping an open mind, and kind of like seizing the opportunity, because you never know where the opportunity is going to come, right? But just gonna like try different things and realize like it's okay to not like something. It's okay to take a little bit of time. It's okay to take a month or 2 months and say, I don't want to do this anymore. I don't like this. And that's okay. And not everything is for everybody, like I wasn't sure if I wanted to be a nurse or a doctor. and my dad was like, no, you should be a doctor. This shouldn't even be a question. And I'm like, but I kind of like everything about medicine. Like, what if I just want to be a nurse? And so, I mean, go out there and see what a nurse does. Go out there and see what a doctor does and say, what do you want to do? What's in your path? What are you able to dedicate your time to? And does it bring you joy? And pivot if it doesn't.
So yeah, I think that's all the questions. Everyone's just saying thank you so much for your time.
Oh, thank you.